Hi, and welcome to another edition of Camosun Today. I'm Chantal Costaz, and I'm here in front of the brand new Dental Health Education Center on the Lansdowne campus. Our program will introduce you to the people responsible for the new facilities, and we'll meet the instructors. We'll also explain the difference between the dental hygienist and the dental assistant programs offered here. And we'll take a very close look at the teeth cleaning process. The official sod turning for the new dental and health education facility was held on November 11th, 1989, and marked the beginning of construction for the building.
You, along with the minister and the chairman of our board, to gather with us at the entrance here. We're going to cut the ribbon commemorating the opening of our building.
That was the opening ceremony in September of this year. Janet McLeod spoke with Neil Murphy this afternoon to find out just how Camosun College obtained the new dental facilities. Janet?
Hi, I'm talking with Neil Murphy, who is Dean of Health and Human Services at the Lansdowne campus, and he is a major force behind the construction of our new dental building. Why was it necessary to have these new dental facilities?
The main reason was the introduction of the dental hygiene program, a new 2-year program with 24 students in each year and requiring a lot of clinical training time. And we just didn't have the space in our existing clinic.
I know that planning for the building started in March of 1989. Why did the building get built so fast?
We were lucky, I guess, and we wanted it badly enough. It was very well designed. I think we had visited an existing facilities over at Vancouver Community College, up at the other dental hygiene program in the province of New Caledonia in Prince George. The architects did an excellent job consulting with the dentists and various levels of the professions in dental to determine just what do you need in order to be able to operate, what do you need in order to be able to properly train the students. So the amount of changes to be made along the way were minimal. That really speeded up the building process.
Now this is a big question. Where did the funding come from for these beautifully built new facilities?
It takes a lot of funding in terms of the building that you've alluded to, in terms of the very expensive state-of-the-art equipment that one requires, and also the intensive training, because you have to work on a very low ratio in the clinic of 6 students to 1 instructor in order to get the kind of supervised learning experience that's required. All of the money, pretty well all of it, apart from student fees, which are not to be discounted, the money comes from the Ministry of Advanced Education, so ultimately from the taxpayer through the government. And then augmenting that are the student fees, as I mentioned, and also donations from particularly the medical profession. We have had sizable donations towards the purchase of equipment. But the lion's share is directly from the Ministry of Advanced Education.
How did the hygiene program wind up in Victoria?
Oh, that's a long story. But to try and shorten it, we were approached by the College of Dental Surgeons, which oversees the training of dental professionals for the province, to start a program, to build on our existing dental assisting program and add the 2-year hygiene program. And after a survey of the community, in fact of the whole island, and determining that indeed there was a need for trained personnel, we put together a proposal with the help of local dentists and hygienists, presented that to the ministry, and among many competing colleges, our proposal was accepted.
What do you think the job market will be like for the graduates of the dental and the hygiene programs?
I think there'll be excellent prospects in both cases. The dental assisting program has a very well established reputation throughout Vancouver Island and in fact across the province, and our graduates have always done very well. In fact, they're in demand long before they graduate. One of the factors that helps them in obtaining placement is the fact that they go out and work in clinics as they progress through the year, and then do quite extensive internship, you could call it, towards the end. So they very often get job offers as a result of that. The dentists want to keep them in their employ. In the case of the dental hygienist, there's a national shortage, and that is in all likelihood going to continue until there are more programs on stream. Like the graduates of our program now will obviously help the situation, but supply and demand, certainly for the next 5 to 10 years, will mean that they have a choice of where they want to work, who they want to work for.
That
so
sounds
excellent
great.
job opportunities.
Well, I'm off to sign up.
You'll have to get on the wait list to get in.
Oh, how long is the wait list?
Well, we only take in 24 into dental hygiene, so there's certainly double that on the wait list. And the applicants required to have completed a full first year of college or university before they can get into the program. So it's pretty demanding in terms of entrance level as well.
Well, it's a prestigious program, and it sounds like a good place to be. So thanks a lot for talking with
You're
us.
very welcome, Janet.
Thanks, Janet. Next, Russ Smith spoke with Dr. Phillip about the lobbying for the building. Russ?
Dr. Phillip, we're rather pleased with our new dental building up at Camosun College. I understand you had a good deal to do with its initial conception.
Well, the dental building is I'm very pleased with it, mainly because it's the culmination of a lot of hard work by a lot of people. What it's given us is a focus for dental health in the community, and it gives us an opportunity to train people to assist the dentist in maintaining and upgrading the dental health of the community. Our building is, I think, state-of-the-art in Canada, and already we've got indications that we're the envy of certainly a lot of the other places in the province, particularly I think Malaspina, Okanagan, and we've had visits from a representative of these colleges and also Vancouver Community College. So we're pretty pleased with the building. It's a wonderful facility, and it's a wonderful opportunity for the students to have this type of environment in which to study. It really is great.
Now, acquiring a building like this is no small feat. It takes a lot of time and effort to be able to get out there into the community and ask the right people and get it happening.
Well, I think that you have to realize that we only have a certain amount of money to spend in any situation, and the provincial government in its wisdom has priorities. And what we tried to do was to create an environment that they saw that our priority at Camosun College was most pressing. I think that was really important to get the message across to the politicians that Camosun College needed a proper training facility. We were in the Fisher building, and from the Fisher building, prior to the Fisher building, we were in the basement of the Times Colonist building when the program first started. And this new building is, as I said, the culmination of a lot of hard work by a lot of people. And I take pride in the fact that I was able to make the awareness, to raise the awareness of the politicians and the people who spend the money to help us realize our dream. And we're really proud of it.
Thanks, Russ. Allison Hughes spoke with Jackie Andrews in our studios today and asked her about the dental assistant program.
With me today is Jackie Andrews, head of the dental assistant program. Jackie, how long have you been at Camosun College?
I've been here 14 years.
And has the dental assistant program always been at the Lansdowne campus?
No, originally we started out in the Times Colonist building, and that was in 1974. And from there, in 1980, we moved to the Fisher building at the Lansdowne campus.
So I guess you've seen the progression of the new Dental Health Education Center right from the beginning stages right up to the completion. And I know that you were quite involved in the planning and some of the design of the new building. Can you tell me what areas you worked in?
Well, I've been with it just right from the inception. We worked with the architects on the design. They came up with a design, brought it to us, and we said, yes, this will work, no, that won't work, type of thing. And once we settled on what we wanted in our clinic, then we worked on into colors.
Along with the new facility, you have some new state-of-the-art equipment. What new equipment have you gotten?
Well, we had old equipment from our other facility, and we had 11 chairs there. We now have 28 chairs, so we had to supplement it quite a bit. And we ended up purchasing about $450,000 worth of new equipment to give us the state-of-the-art to meet the new asepsis techniques that are having to be practiced now with the hepatitis and the AIDS situation.
What about the sterilization process? There's a new you have a specialized room in the building for that?
We have what we call our dispensary, and the dispensary is a secure area, and one end is anything that's used out in the clinic and in the patient's mouth is the dirty end, and then it goes through a process within the dispensary of sterilization and disinfection and packaging, and then it comes out at the other end of that room as the sterile items, so that everything that goes into the patient's mouth has been sterilized.
And I guess that's a very important aspect.
Yeah. Yes, with the problems with cross-contamination of some of the communicable diseases, it's necessary that the students are trained in the very best of and most current techniques in sterilization, so gloves, masks, eye safety wear, that type of thing.
And what does a dental assistant do?
A certified dental assistant is trained to work independently and also dependently. So when we say that she's working independently, she may be working doing certain skills in a patient's mouth or providing certain treatments in a patient's mouth without the dentist being there, such as cleaning the teeth or taking x-rays, that type of thing. Then also they work dependently, so they're working alongside the dentist by assisting the dentist, him or her, in different procedures that they're doing in the patient's mouth, and whether it's to do with crown and bridge or whether it's to do with restorations.
And people that are thinking about taking the program, what can they expect sort of for workload, that sort of thing?
It is a heavy workload at Camosun. We have a fair amount of demands that are put on the students. They're taking 2 psychology courses, interpersonal relationships, and they're also taking advanced communication skills, plus their dental assisting program. They come into the program in September, and it's a 10-month program. So at the end of 10 months, they have a marketable skill.
And what is the intake for the program?
We take in 40 students in September.
And is there a waiting list?
Usually about a year.
Okay, besides the student loans that are available, is there any special funding, any trust funds for students?
The only ones that I know of is sponsorship through Manpower. Manpower will sponsor 8 students for the 10-month program.
So that's for every students for the intake, you take 8 students and
yeah.
through that.
32 would be fee payers and 8 would be Manpower sponsored.
And what are the prerequisites for the dental assistant program?
It's grade 12, including biology grade 12, and or chemistry 11, with CPR level C, and first aid, whether it's SOFA or whether it's St. John's Ambulance.
Okay, well, I'd like to thank you very much for your time today and wish you the best of luck in the new facility.
Thanks very much,
Thanks.
Alison.
We spoke with some students at the clinic to find out what they had to say about the programs and the new facilities.
We have a much more spacious building than we did last year, and it allows us to all work together, the first and second year hygiene students as well as the certified dental assistants, just to get a chance to get to know what our duties involve and how we can work together as a team once we get out into the office. It's a lot more modern equipment than we had last year, and this is going to allow us to be on the cutting edge when we get out and working as well, to know how to use all of the equipment that we're going to run into in the real world.
The facilities at Camosun College are excellent, and the new dental building has everything that the hygienists and assistants need. The instructors are really patient and very knowledgeable, and I'm really enjoying the course so far. Can't wait to get finished and get out there.
My name is Sandy. I'm a dental hygiene student at Camosun College. I've been a dental assistant for 3.5 years, and the reason I came into the program is because I want to pursue my goals further in dentistry, and I'm really enjoying the program so far.
I'm a first-year dental hygiene student, and the reason I chose Camosun over Vancouver Vocational Institute was because it's located on the island, and it is close to home, and it is an accredited program, along with having the nicest facilities in Canada. So that's why I chose Camosun.
Allison also spoke with the coordinator of the dental hygiene program.
With me today is Diane Gallagher, who is head of the dental hygiene program at Camosun College. Diane, you recently moved here from Saskatchewan. What did you do in Saskatchewan?
Allison, in Saskatchewan, I was involved in allied dental health education. We had a program there that prepared dental hygienists, dental assistants, and dental therapists for work in the private sector.
And how did you come to Camosun College?
I was recruited by Dr. Neil Murphy, who is dean of our division, and he invited me to come to Camosun and set up a program in dental hygiene.
And there's been a lot of positive feedback about the new dental facility. How do you feel about it?
Our new dental facility at Camosun is just fabulous. We're really pleased to be working in it. The building was designed with education in mind, and attention was paid to the detail of traffic flow and being able to set it up for teaching purposes. It's working very well for us.
So there really was a lot of thought put into it. And
there certainly was.
Yeah.
And we were able to have some input into the building design, and it wasn't something that was just thrust upon us. And you know, we have classrooms and lab facilities and a very large 28-chair clinic, a nice reception area with a learning lab that is set up with computers so that our students can learn to manage patient accounts and records in computers.
Wow. What is the role of a dental hygienist?
A dental hygienist is a licensed health professional, and they're primarily concerned with the prevention of gum disease and dental decay. And they have a specialty education to prepare them to work with people in the community to do health promotion and preventive dental care.
How long is the program at Camosun?
This program is 2 years long and of 2 10-month academic years, and every applicant is required to have 1 year of university before they come in.
Oh, really? What sort of courses are they required to have?
Well, the required courses are the basis for other courses in dental hygiene, and they include psychology and biology, chemistry, English, and 1 elective.
Wow. So there's quite a range of areas that they're
Yes, they
studying.
need the science background to support the dental sciences, and they need
the writing skills, because each graduate is expected to be able to produce academic papers and to do literature research and report. We actually teach the students to write, or we hope we do, to publication level.
Wow. What is the student intake for the program?
We have 24 seats in each year, 24 in first year and 24 in second year. And this year we have only 16 in second year because we had shared old facilities last year. But now that we have the new clinic, we have room for 48 students.
Who employs dental hygienists?
Well, Allison, 80% of dental hygienists work in private dental practices and work with dentists as part of the dental team. There are new roles, though, in dental hygiene emerging in community health settings, where dental hygienists will design oral health programs for groups specific to their needs. And some examples of those settings would be in chronic care institutions, wellness centers. They might do programs for prenatal classes in conjunction with community health nurses, or they might work in schools. And in most community health settings in BC are school programs, although we are working towards having hygienists based in homes for the elderly and special mobile programs for well elderly.
And I've heard about public services that you offer. Can anyone just come in and take advantage of these? Or what?
Yes. We do offer services to the public. Primarily, we do oral health assessments. And if the patients are suitable for care in our program, and most are, almost all people who come in are suitable for us, we will design a series of appointments to meet their needs, and our students will provide the care under supervision of a licensed dentist and licensed dental hygienists who are instructors. And if people need care beyond what we can provide, then we will refer them to the private sector, to dentists out there in private practice.
So an example of something you might do is a teeth cleaning or checkup, that
we can do cleaning, we can do oral health assessment, cancer screening. We will take dental x-rays if they're needed. We'll apply sealants and do fluoride treatments, and really the whole gamut of work that is done by a dental hygienist in private practice.
And I guess there's a cost for people coming in, and
dental x-ray films are $1 each.
Wow.
Yeah, it's quite a break for the public coming in, but on the other hand, they pay with their time because it takes a long time to carry out the care because it's done by students.
So it is a lot cheaper, which is good, but it takes a bit more time. But I guess it's worth it when you're, to save the money. I guess a lot of people that can't afford.
I think it is a way to provide access to care for some people in the community that are not getting care at the moment.
Okay, well, I'd like to thank you very much today, and good luck in the new building and facility.
It was my pleasure, Allison.
Thanks.
Janet went to get her teeth assessed for a cleaning. Before starting, she had to fill out a health history form and a consent form. Then, a blood pressure test, a palpation of the head was done to check for any soreness or abnormal bumps. Before a student can work on a patient, the patient must be seen by Dr. Bassett, the resident dentist. Who takes a look around. Everything's normal. Now that Janet has been examined by Dr. Bassett, she can return next week to continue the treatment with Kathleen Day, a second-year dental hygiene student. Kathleen explained to Janet about the treatment plan they had for her. According to the assessment of the first appointment, it is decided that Janet does not need to have her teeth polished. However, a teeth cleaning is recommended because food and bacteria, which are always present in the mouth, become plaque. If plaque is not removed, you have a calculus buildup. This affects the surrounding structures of your tooth, like gum and bone. Plaque will irritate the gums, and that in turn will lead to large pocket depth. Kathleen explained the first step of probing. When probing, the pocket depth between the tooth and the gum is determined. A healthy tooth has no more than a 3 millimeter pocket depth. Kathleen then looks for any rough surfaces and removes the hard deposits from Janet's teeth. After the cleaning, Janet demonstrates how she brushes her teeth, but Kathleen sees room for improvement and recommends using the circular motion. Use this motion above the gum line and spend a little more time in each spot. Overall, it is recommended you spend 3 minutes brushing your teeth. Kathleen spent some time explaining the importance of flossing. Floss must be wrapped between your middle fingers. Grab floss with thumb and index finger. Insert the floss and move up in a seesaw motion toward the gum. Now you are ready to floss in an up and down motion. Be sure to splay the floss between the gum and the tooth. An assessment at the clinic is $10. A cleaning, another $10. Make sure you have plenty of time. You will have to do 2 or 3 sessions, and each one will be at least 2 hours in length. That's our program for today. Thanks for joining us. Don't forget, brush and floss every day. Join us next week when Camosun Today takes a look at ways of getting to and from school. Your comments are welcome.